Good afternoon, everyone. I'm Dr. Randall Maxey, and I'm joined by Dr. Barbara Neighbors-Stevens, Dr. Ivan Walks, and Dr. Jocelyn Hines. And I welcome them as our co-moderators. And I believe we have a special treat today. I was honored earlier today to interview the distinguished Reverend Jesse Jackson. And in the early part of the show, I will present our interview with him. Good Lord willing, the creek don't rise. How you doing, Dr. Walks and Dr. Hines and Dr. Neighbors-Stevens?
I'm doing well, Dr. Maxey. Good to be with you. I'm very excited to hear your interview with Reverend Jesse Jackson. Sounds very exciting today.
Yeah, he hit on some very important and interesting talks. How are you, Dr. Hines and Dr. Neighbors-Stevens?
There's Dr. Hines is on mute. We can get her unmuted.
Hi guys, I'm having some internet issues, but I am here and I'm working on them. So.
Okay.
All right.
And if I'm right, Dr. Stevens is somewhere on the road between Tampa, Florida and Tennessee. Is Dr. Neighbor, can we hear from you?
I don't see Dr. Neighbors-Stevens on right now. She's probably exceeding the posted speed limit and is trying to keep her profile as low as possible right now. I do not see her on.
I think that's called Alligator Alley down there. So we wish her. So last week, we had a very important discussion about the use of the word woke and the impugning of using the social determinants of health regarding Americans of African descent. So we want to continue that somewhat, and then we want to talk about the new guidelines or new lack of guidelines. Simon, can you put up the slides, please? So Dr. Hines and Dr. Walks, while we're waiting, one of the items of concern this week was that we have been for the past 2.5 years talking about vaccines and guidelines and social distancing. Let's go to the first slide. The next slide, please. So in medical news, we know that researchers are testing the first potential vaccine for Lyme disease in 20 years. And this is going to be manufactured by Pfizer and a French biotech lab. And Lyme disease is a disease that affects people who get infested with ticks. And it can be a very uncomfortable, if not dangerous disease. We also
now, Dr. Maxey, to stay right there for a minute. When I was growing up in Southern California and going to school, I never really heard much about Lyme disease. But on the East Coast, we have these deer running around, and there's a lot of Lyme disease. Is that just me, or is that something that is more common on the East Coast?
I think it's out here too.
Okay.
And I would just chime in that because of climate change, the area for where deer ticks are endemic is changing. So it used to be more of a Northeast kind of issue, but certainly on the eastern side, it is moving south, so that it is not just the problem of the Pennsylvania's, New York, Maryland, but moving further into the Virginias, North Carolinas as well.
Okay.
Good. So we hope that Pfizer's getting ready to make a whole lot of money in the past couple of years. We should buy a little bit of stock. They coming up with everything. Uh, uh, as of Tuesday at 8 a.m. Eastern Daylight Time, the unofficial U.S. COVID-19 toll reached 92,241 cases and 1,034,021 deaths, an increase of 128,194 and 464 respectively since this time just yesterday. Pending regulatory approval, Pfizer with BioNTech Omicron-specific COVID vaccine could be ready to roll out as soon as this October. So that's good. So we're going to talk about getting your next BioNTech shot. Now, this is also very interesting that nearly 60% of all human pathogens have been aggravated by climate hazards, according to the nature and climate change. So it's stirring up the Indians, so to speak, that all of these things are coming to bear. Next slide, Simon. So mask and COVID-19. We know that a group of 23 state attorneys generally led by Florida, told a federal court Monday that the CDC does not have legal authority to impose a nationwide transportation mask mandate to address COVID-19. They had asked the court to reject the agency's overreach. So this is the federal government trying to make nationwide transportation masks on planes, et cetera. And these 23 state attorney generals are trying to fight it and say that the government is overreaching. Next slide.
So Dr. Maxey, before you leave this, and as I understand it, this is a concern for COVID-19, but if we have other contagious things that come our way, which is more likely than not, they're trying to say that from state to state, you cannot impose these kinds of guidelines. It's kind of crazy as people are traveling and flying across multiple states, driving across multiple states, that if something like this goes into place, the CDC will not be able to put guidelines in place, period. If these folks are successful, it'll have to go state by state.
So if you recall, back in the 50s and 60s, we were fighting the concept of states' rights. And the reason we were fighting the concept of states' rights being superior, because states were lynching and shooting African Americans. And if it were not for federal laws and guidelines, our communities would be at risk. So we moved certain things out of very small places like Mississippi, Louisiana, Alabama, and South Carolina. And that's why we're very concerned about the state versus the nation. So we definitely want to discuss that, doctors. Next slide. So monkeypox injection. So the Biden administration has decided to use a new strategy to stretch its limited supply of monkeypox vaccine. And they're going to do this by doing a different type of injection. The injections that we have been having recently with the COVID vaccine has been intramuscular. They want to do this intradermally. If you remember how we give a TB test, for example, they put it right under the skin and you can use 1/5 as much of the shot. And this is thought to expand the ability to vaccinate more people. And we'll talk about that as we go on. So this is based upon a paper got funded by National Institutes of Health. We also know that monkeypox can show up in a variety of clinical presentations, and clinicians should have a low threshold for suspicion of the virus. So that's something to all you docs and people going to doctors, we should not be holding off for absolute total proof before we think that this person needs to be protected. Next slide. Now, this one is somewhat amorphous, but I believe that the esteemed, and I use that word with air quotes around it, Supreme Court Justice Clarence Thomas has said that there is no right to privacy. And I didn't know if you knew that or not, Dr. Walks, as a psychiatrist, but that's what he said. And I know he's not a friend of yours, but there is no protected right to health care in the United States. We know that in the Bill of Rights, it speaks to the right to life and liberty, but they're taking a lot of liberties with how they interpret this. So we do not really have definitive rights that cannot be taken away. Healthcare is not a right, but it's high time we change that. And this is one of the key things that the esteemed Reverend Jesse Jackson brought up this morning. I think that's the end of the slides. Let's talk about them, and then shortly we'll get to the interview with Reverend Jesse Jackson. So, Dr. Walks, you were selected as chair of our vaccine committee, and you reviewed with your committee of physicians and healthcare professionals all of the information that the National Medical Association, at that time led by our president at that time, and you also reviewed with that committee all of the FDA and the information from the CDC and with the experts. And what did you come up with, and how does this fit in with the announcements by the CDC that as of now, there are essentially no guidelines? And they're saying that you don't need to quarantine, but what you can do, if you're exposed, you can wear a high quality mask when you go out.
So Dr. Maxey, there, at the time that the vaccines were being considered, there was a strategy to stop the spread of the virus. We were very concerned. When I say we, I mean the American public were very concerned that as the vaccine spread, people would become ill. And as people became ill, there was a risk of death, and there was a risk of significant illness. Even if you don't die, if you spend 2 or 3 or 4 months in an intensive care unit because COVID-19 has attacked your body, we began to recognize it was not just a respiratory disease, but it would affect all body systems, including just the ability to think properly. So there was a strategy to get people to not get sick. And then if you get sick, don't get anybody else sick. That was basically the strategy. Don't get sick, don't get infected, and don't infect anyone else. And I think we have seen both politically and especially politically, but also practically, that strategy has changed now to where the message is try not to get sick, do what you can, but don't impinge on anybody else's right to walk around and get other people sick. That's the only polite way I can say it. We have decided that the pandemic is now the SARS-CoV-2 virus, COVID-19, is now endemic in the population. And so trying to get people to stop spreading it one to the other is something that the government is saying people should do. You should try to keep yourself from getting sick, and you should try to keep others from getting sick. And that's very different from the strategy back then, which was one of you must prevent other folks from getting sick, and you must prevent the spread. So you must wear a mask, you must keep a certain amount of distance. If kids are going to be in school, their desks must be a certain distance apart. You must look at the the spread in your community, whether it's low, medium, or high. And if it's high, you must do. All of those must do's have pretty much gone away, and they're now recommendations. So clearly, we are still recommending that folks do what they can to stop the spread of the virus, to keep themselves and others from getting sick. But that's no longer the overall strategy of the country. It appears to be one of, these are the things you should do, as opposed to these are the things you must do. I don't know if that's pretty clear.
It's pretty clear. Dr. Hines, what are your thoughts? What's really changed?
Or I think Dr. Hines is still on mute.
And you can't identify Dr. Neighbor Stevens yet, right?
I don't see Dr. Neighbor Stevens yet. I think she's still driving through, what did you call it?
Alligator Alley.
Alligator Alley?
Yeah.
Yeah. And,
So,
okay, Dr. Hines is off mute now.
I just wanted to add that in addition to fully agreeing with what you said, I also think that one of the things that is different about the recommendations is at this point, though, so much of the population has some degree of baseline immunity, be it immunity from having been infected, immunity from being vaccinated, immunity from being infected and vaccinated, which is also plays a factor in why the recommendations have changed, or the strategy, I will say, seems to have changed a bit, is because the population is different now than it was 2 years ago as it relates to COVID.
okay, let me present a theoretical case, and I'd like the two of you to react, and some of our other advisors. 65-year-old Black woman with a history of diabetes. She is 5'5", and she weighs 220 pounds. And I'm going to make up a BMI of 35. I don't know if that calculates out, Dr. Hines, don't crucify me. And she also has asthma. And the CDC says, well, on your trip from Los Angeles to New York City, you don't need to wear a mask, and you don't need to be concerned. What are your thoughts about what that lady should do?
Well, I'll say this. What I haven't heard the CDC say is you don't need to be concerned and that you don't need to mask. What I read is you are not required to do so, right? Mm-hmm. There's a difference between you are not required to eat your fruits and vegetables, and you are recommended to do so, right? And mm-hmm. Absolutely, under any type of greater risk scenario, the recommendations are still there to say to mask. The recommendations are still there to say to put your mask on indoors if you're in a place of high risk activity. The information is out there to know what your county transmission rates and for example, in the scenario that you said, where you're traveling to, where you're traveling from. Here's what in the airport, you're traveling with everybody. So there are still recommendations to take precautions. It's just not requirements.
Okay. And there's another question before we recognize Dr. Jordan. I see his hand. Do we believe, or do we know that communities of color may be at a higher risk for not only COVID, but other items of concern in the infectious disease capacity? Are we at more risk for getting sick, getting seriously sick, and getting infected?
So Dr. Maxey, I think we've made it very clear previously on the Black Health Trust that it is important for us to accept the fact that when we have what are called pre-existing conditions, they put us at higher risk. if you look at all of the recommendations over the last 2 years, there's always been somewhere within what's come out of CDC and other places, the acknowledgement that there are things, there are conditions, situations that put folks at higher risk. One of those is older age, because that can impact the effectiveness of our immune system. Those other sorts of illnesses that are prevalent in some parts of our country and in our community, like you often mention, Dr. Maxey, diabetes, heart disease, certainly kidney disease. There are a lot of things that put us at higher risk. And so if we just read that first line of what the current recommendations may be, we're missing the fact that many of us, or many people in our family, may be in that higher risk category.
Dr. Wilbur Jordan, can we make sure he's unmuted?
Dr. Jordan is
unmuted.
unmuted, and then we have Dr. Faget, who has his hand up for a question afterward.
Okay,
Good morning, sir.
Morning,
Thank you.
Dr.
I may be a little insensitive this morning. I'm aware of it, so don't jump on me.
We're going to just pray for you, Dr. Jordan, that you
That's right.
are
I
not
need all the prayer. I need
insensitive.
all the praying you can give me. I was back. If you go to Southeast Asia, you rarely see someone who is what we call overweight. You hop on the plane, you come back here, and before you get out of baggage claim, you see 5 people who you think are hippos and drag.
Oh my.
Too many of us are overweight. I don't mean a BMI of 30, I mean a BMI of 45. There is no reason today for so many of our folks, including some of my relatives, to be that massively overweight. And yes, when you are that overweight, COVID is jumping up and down, thanking you. Some of the issues we have to deal with that we don't want to face are some of our social problems. Let's go back to HIV, which we all know about. At one point in time, I had a clinic specifically for ministers on Saturday morning. And all of them were concerned with STDs, HIV, getting up in the pulpit, preaching God did make Adam and Steve, he made Adam and Eve, and then they were out Saturday night going with Steve. We have to deal with that issue. When it comes to monkeypox, the 3 patients I have treated so far with monkeypox first tried to convince me they didn't have monkeypox. This is monkeypox. I treated smallpox for a year. I know monkeypox and smallpox. Then they tried to convince me they were strictly heterosexual. I said, point 2, and Randall, I need your help. The NMA needs to come out and make a distinction among Black folks. Every Black man who's had sex with a man is not a homosexual. He's had a homosexual act. And there's a big damn difference. And we need to be the ones to push that.
that's
But
a
we
good
have
point.
to learn how to be receptive enough to allow our macho brothers to be able to tell me they did A, B, C, or D, because that's what's going on.
And maybe that's something we should discuss on one of our other calls with Dr.
No, I
Walsh
think we do. Yeah.
about the stigma of
The
a
stigma is a big problem, and I think we have to be the ones to lead the issue about stigma. Stigma both for having HIV, women have stigma. We're still seeing patients who come in, they've been infected 5 or 6 years or more. You shouldn't be doing that now. When you look at Asians or Caucasians, they come in. We still suffer because we lose a certain amount of our immune system when we have pills right here that can treat you. We still see young men coming in. I told one 3 months ago. I said, can I be very frank with you? He said, yes. If I was your daddy, I'd whoop your ass all over this place. And he looked at me and said, why? You got infected 6 months ago. There is no damn reason for you, a college student, to be getting infected 6 months ago. There is PrEP. He said, I don't like taking pills. You're going to be taking more pills now. I mean,
No, I think the points that you
These are
bring up,
things, but these are cultural things we have to deal with in terms of some of the reasons we keep seeing high numbers is because we're not dealing with some of the cultural issues. And thank
Yeah.
you. And no, I'm not a bigot. I just want to say it the way I feel.
Okay, that's perfectly fine. So Dr. Walsh, maybe that can be a future program where we can talk about what Dr. Jordan said, a homosexual act versus being a homosexual. And I guess there's a distinction there.
Well, Dr. Maxey, I think we should talk about those kinds of things. And I think what Dr. Jordan is talking about is an opportunity to get someone in for treatment versus the labeling of people and calling them something. And I think it is important that we are less concerned about putting a label on someone and more concerned about getting someone in. Dr. Faget has been very, very patient with his hand up also, Dr. Maxey.
Dr. Faget, my teacher.
You're still on mute, sir. We have to work to get you off mute because, you know, some of you, oh, there you go, he's off.
Oh, my prayers are with my good friend and colleague, Wilbur Jordan, I tell you. But his comments are very timely. And Randall, I want to thank you for Black Health Trust. I saw you in Atlanta as you were leaving that hotspot place at the Hyatt. Because I'm not sure that's where I got positive, but when I got back from Atlanta, I was positive. I went from the plane. I went from BWI to Walter Reed to be tested because my wife was just getting over temporal arteritis and was on prednisone. I did not want to take the COVID virus home to her.
Right.
So I went to Walter Reed. They did the workup, and again, you can get all this stuff online now, but I really warn your audience. Walter Reed did a very complete workup in terms of my kidney and liver function. I made sure I met the criteria for Paxlovid treatment, and then put me on a low dose of Paxlovid, 2 tablets twice a day, 5 days. They recommend isolation for 10 days at that time. And the change in guidelines from CDC are dramatic, no question. Happy to say I have recovered. I did have chronic cough. I had fever. Paxlovid does give you some GI problems. But again, it just emphasizes we do have now so many tools to fight the virus. It is a different virus. BA.5 is different from Omicron. And after 4 days, I was really pretty good. Then on the 5th day, I got a little sick again, but overcame that. It was not a real rebound. So I've been COVID negative now. My test turned negative on the 6th day. I think to Dr. Jordan's part, Paxlovid really utilizes antiviral kind of medication, ritonavir, and Wilbur can tell us about the other one. So rather than having the 300, 100 type, I had the 150, 100, and Wilbur can tell us about that composition of the Paxlovid medication. Of course, Paxlovid is said to be more effective than molnupiravir, which my company did clinical trials on. Molnupiravir does have good efficacy against renal involvement, and Paxlovid is said to have 90%. So I can attest it's very effective. But I think just to reemphasize the very correct statements by Dr. Hines, Dr. Walsh, and Dr. Maxey, we are now in a position of having to live with the virus, no question about it. Now with me, since I had irregular heartbeat, as well as the early respiratory stuff, my pulse ox only went down to 96. They told me they wouldn't be too concerned until it got down to 92. I was able to fall in at home. It never got below 96, got back to 98 by day 3. So again, I offer this, I might say that, very interesting. I got infected at the Michigan dinner at the NMA, I'm sure. I say that because when I called back to see who I was talking to unmasked, 2 of the physicians, one was positive, and said he did not require any treatment. The other one was negative. So again, that's a whole discussion.
Yeah.
We
The bottom line, you can't really tell who is harboring.
correct.
So
The one that affected me is still pretty much asymptomatic, but just positive. So
yeah.
I might add that he got his from the White House, but that's another issue. So I'm gonna stop here because I am so excited. The reason I've been away for a while, but Randall, when I saw your title, I knew that you were bringing the discussion, as my pastor said today, a hinge point, where we now have to really get busy about how we can better help us fight the disease. Now that we've been told it's going to be a do-it-yourself kind of approach. So I rest my case. I yield my time back, and thank you so much for all the Black Health is doing for our community.
And thank you, Dr. Walter Fijay. I appreciate you, man, for
So
more
than Dr. Maxey, can I just interrupt
of course.
For just a moment? Dr. Walter Fijay just said something that I think we need to listen very carefully to. Not only the importance of getting treatment, but as a fellow veteran, Dr. Fijay, I really appreciate the fact that you could go straight from BWI to Walter Reed and get the kind of care that you talked about. Many of us don't have access to that. There's not a place that we can go and get that kind of workup, especially as we have some other health concerns that don't keep us from doing stuff. I know Walt is all over the country. He's going to NMA. He's doing his thing, and he is on surface a very healthy and totally functional person, and goes where he wants to go. Well, wherever Pat lets him go. But anyway, so I think it's important for us to recognize that many folks in our community don't have that kind of resource at our disposal. And so we need to be very careful that we are paying attention, that we know what sorts of resources we have, we know where we can go to get care when we have any sorts of symptoms, and not just say, oh, well, I saw Dr. Walt on the Black Health Trust, and he said he was fine. He got treatment right away. He had, how many of us can actually get someone to monitor our pulse ox, which is the key if you have something that's going to be attacking your lungs. So Dr. Maxey has talked about home monitoring, and he's talked about other kinds of resources, but it's important for us to understand where those resources are, get access to those resources, so we know what are we going to do. Walt knew, Dr. Fajay knew, oh, I think I might have gotten some exposure to Omicron. Let me go right now to Walter Reed, because I can go there and they can take care of me. I can't stress enough how important it is to know where Dr. Jordan talks all the time about people having a primary care doctor, knowing where you're going to go when you need help. So I just wanted to emphasize that, Dr. Maxey.
Well, that's good. And Walter walks into Walter Reed as a full bird colonel, so he gets some juice. So let me just
Randall,
yes.
Let's go back in history to a young lady who you sent to me. So I know you know about this. And something Dr. Fajay just said, the man who infected him was asymptomatic, is still asymptomatic, and more than likely has infected other people too, because he's asymptomatic. And you sent me a young lady a long time ago who got infected from a man who was asymptomatic. I mean, so much of what has happened with this, we have all seen it with HIV, period. I mean, very little of this is nothing new. The drug that he was talking about, ritonavir, it's an HIV drug. It's a booster. It boosts other drugs. So much of what we're dealing with now, we have already dealt with. We just have to open the damn book back and realize we have read this chapter before. We got a problem with so many of our men with HIV, embarrassed about having had sex with someone. We have the same problem with so many people now not wanting to tell where they go. We have a privacy issue. So yes, we need to talk about the cultural habits at some other meeting, but I don't think we're going to make inroads into our problem until we can do that, because it's those bad habits. I come to your grandmother's house for Thanksgiving dinner, and she wants me to eat 5 servings. She's a great cook, but I'm eating 1 serving. And that ain't gonna, and she ain't gonna want me to come back no more. Because a part of our mother's esteem is built on us cleaning all the plates. That's a bad cultural habit today.
That's true.
You don't need to weigh 500 pounds.
That's true. You're hitting all the points today, Dr. Jordan. Dr. Hines, a question. There was some controversy just since Dr. Fayette mentioned it, with pulse ox being potentially lower in people of color. I don't know if you've read that or know how significant that may be, but there have been some papers out to try to correct that information so that our pulse ox tests read the same as Caucasians.
We have mentioned pulse ox about 4 times without saying what it is. And there's a comment in the chat that that's when they put the clothespin on your finger. So maybe we can, Dr. Hines, you can start by just mentioning how the pulse ox is measured and what it means when someone has a pulse ox of 98 versus 91. We need to get Dr. Hines unmuted, because y'all don't want the psychiatrist to try to explain it.
Are you unmuted, Dr. Hines?
There we go.
Now we are. All right. So step 1, what is a pulse ox? Pulse ox is short for pulse oximetry. And it is the test that oftentimes someone will put either a little clip or sometimes like a Band-Aid kind of looking thing that has a little light on your fingertips or toe tips to monitor the amount of oxygen in your blood kind of in real time. It is called a pulse ox because it is also typically in line with what your pulse is at the, it tracks your pulse and then comes up with a number that also says how much oxygen is there. Anything more than 95 is considered normal. Most people are hanging out 97 or above. Now, things that can alter the sensitivity of your pulse oximetry reading include things like nail polish. And then there's a thought that the pigmentation of the skin on people of color can also potentially alter the results or the accuracy, I'll say, of the pulse oximetry reading. And because what's on the other end of that little clip or that little Band-Aid is like a little light thing, right? And the pigmentation of skin, or again, like colored nails, fungal nails, super thick nails, all of those kinds of things can potentially impact how that device reads. I have not seen anything that says, I am not personally aware of anything that says that African Americans have a lower goal, but I have seen plenty of documentation, especially since COVID, on the acknowledgement that sometimes our readings are not as accurate for the reasons that I just stated.
That's very interesting. And we know, similar to that we've had estimations of your kidney function.
Yes, 100%.
And that they had, when your lab comes back, there'll be an estimate for a non-African American, an estimate for an African American, and invariably the rigors of those tests were different. So that's been recently removed because that can affect your insurance rates and everything else. I'm asking Simon if we can show our video. We did an interview with the distinguished Reverend Jesse Jackson. I'd like to see if we can show that for a few minutes. He does address some of these issues. Simon? Okay. So
Here we go.
Good afternoon, everyone. I'm Dr. Randall Maxey, and I have the singular pleasure today to meet with Reverend Jesse Jackson. And they tell me that as we get older, we have great wisdom. And I followed Reverend Jesse Jackson for years and looked up to him as a leader, a presidential candidate, a person who went to the Middle East to bring back US military prisoners of war, and followed him as he started Operation Breadbasket and Rainbow Push. And I don't know if he remembers it, but back when I was just finished medical school, Rainbow Push gave me and Fannie Lou Hamer an award for academic excellence for working down in Mississippi. So we welcome Dr. Reverend Jesse Jackson. Thanks for joining us, Reverend.
Yes, sir.
Good. So,
Brenda Lee, my regards.
Okay, well, good. So Brenda Lee Ager is with us, and she may have a comment from here to there, but I'd really like to get your perspective on some of the things you would advise our communities of color to be aware of, and things that we need to do to protect ourselves, both medically and in terms of things like voting rights. Where are we in America today? And what do communities of color need to do for their own advancement and protection, Reverend?
For the inclusion of our power, we determine the course of our nation. For example, right now, I have one hand in voter registration. There are over 500,000 plus blacks in Louisiana, for example, unregistered to vote. 650,000 blacks unregistered in Mississippi. Say 45% black, we could be Sunshine governor, both Sunshine governor in Mississippi. 4% black plus progressive whites plus Latinos, with the majority in that state right now. Our minds must be in the majority. They have majority politics and minority views. So we must empower ourselves. I think that we should right now, for example, demand that citizens automatically register to vote. Shouldn't have to pay a poll tax to register and vote. Before we have to do that, between the amount of money you spend traveling to polls and all that stuff, citizens should be, you know what I'm saying, Dr. Maxey, automatically register to vote as citizens. Secondly, we may, of course, on the health part of it, that we have to have a good primary position that we trust and take symptoms very seriously. We have a tendency, because of our history, of home remedies and stuff such as that, you know. And I think that they're important, but I think that the science of medicine is the other word for sure. Science of medicine, not just home remedies. They have some value, but not scientific.
Excellent, excellent. We've been telling people that they need to all have a primary care physician. And we've presented many physicians over the past 2.5 years from the National Medical Association and from across the world to advise them to be vaccinated and to use social distancing and to use plain old common sense to keep themselves safe. And I know also that you have been involved in issues of the workforce. And we know that many times the jobs that African Americans have and Latino Americans have don't allow you to sit in the ivory tower. We have to be out there with the people and expose ourselves. I know you were involved at my alma mater with the nurses who were on strike. I'd like your comment on what was happening up there with Howard.
Biden is arguing if he gets the president from the Senate, we get free community service hospitals and free community service schools. These are called junior colleges. I was in the hospital with them last year, Parkinson's. Each time the nurses and assistant nurses been trained at King School, trained at Malcolm X College, Community College in Chicago. As we fight for the citizens of power to get free access, means that at 12th grade, you don't have to pretend you're literate. You know you're not. You go to junior college, and it's free, cut half of the tuition cost going to 4-year school. Plus, if you go 2 years and you're hooked in academically, in 4-year school, and you finish up the next 2 years. What I'm saying, Dr. Maxson, you cut the cost of healthcare training in half. These schools train people in trades, medicine, science, literature, and computer science. Nothing you do, you're not able to put the curriculum include you. The only concern the rest of the world can get advantage of that situation.
So some years ago, when I was a freshman in medical school, I met a young lady who was with Jerry Butler. And turned out that she was one of the original people with you and when you started Operation Breadbasket. Miss Brenda Lee Ager, how are you? Can you unmute yourself, Brenda? So we're not hearing her. But you had a group of singers with you, Reverend Jackson, and Brenda is a part of the Black Health Trust. I'm going to try to get her on the phone. But tell me how they helped your program. The singers, the musicians.
They have the platform for the talents. I mean, Brenda and I've been singing at Breadbasket. She wouldn't have met Jerry Butler and become the star she has become as a singer. But Pat Henley and Dolores Scott, the whole group of singers, brought joy to our people. People need a sense of joy and hope. And they've certainly brought joy and hope in their talents. So Brenda, good morning, ma'am.
Good morning, sir. How are you?
Good.
It's good to see your face.
Yes, ma'am.
And let me tell Randall right now that you, and I always say this, you're actually responsible for my career by putting me together with your brother to write a song. So I owe you a lot, Rev. Not only was it an honor to be working with you and walking with you and singing for you, it's just an honor to know that I really know you and love you and respect you. And thank you for all you've done in this country and around the world to make it better for all of us. I really appreciate you.
Well, that's so great. And I look up him to also, well, Reverend, I'll tell you, I'm about 1.5 months younger than you are. So I've been looking up to you for a long time. Looking up for you to a long time. My sister went to school at Tennessee State when you were going to school in Tennessee, I believe, as well. So as we look at you over the years, what are the most meaningful things that you feel you have been involved in your long career?
You're a lifetime long distance brother. When I was 18 years old, I'll be 81 next month. I'm going to feel 62 years. I've been married 60 years, I might add. And I tell you, being committed to something that's meaningful to you. It's not a work, it's a job, it's a mission. I tell young people who work with me, they get burned out. Because they're on the job. I'm on a mission. And I feel it's divine is blessed. It's a blessed mission. The evidence of it is how long we've been doing it effectively. Now, in Chicago, we have to transform the culture. which had the tone for urban America, which Dr. King gave assignment to do. Ministers were talking backward theology, how people should adjust, how they should behave better. Many of those ministers were on Data's payroll, getting $30,000 on commission. And those ministers got freed up from the intimidation of Daily. He freed people up. Remember one time when girls wearing naturals who were used on the airlines, they lost their jobs, such as that. So we brought that down. We proposed to get people like Red Fox, who was on TV, whose TV show was dropped, back on the air and take care of his business. Then when we looked at the Congressional Black Caucus, went to one of them, or several of them, all of them really. And about 8 of them at the time, Dave from Detroit and Hawkins from LA and Dawson from Chicago and Rangel after he succeeded Adam Powell. And what I found was that people come to the caucus, they say, well, it's good, we can waste my time. But it was not waste their time. The mission was political relationships and contacts. Then they met each other. Jerry met Ego on a music, the Riverbanks became kind of music place where people come to join and do that stuff. Now, that's a bit of transforming that. But politically, we got the right to vote. But that's the protection of the right to vote doesn't mean very much. If it's states' rights, they manipulate us. Arkansas, 400,000 blacks unregistered. From Virginia around to Texas, more unregistered voters, the number is greater than the number of the governor of the Central one. But one huge political power. So we must, in fact, register with passion. Try to get all high school seniors to come or say with a plume in one hand, with a card in the other. 3.3 million of them. Why should be registered? Only those who register serve on juries. If in Emmett Till's trial there had been one black resistor and you broke up the thing, you had the hung jury, whose guy went to jail then, not now. But due to an old woman who lied on Emmett Till, got him all messed up and killed. So that's part of my work. I think a part of it was bringing Americans home. Foreign jails, Cuba, Iran, Iraq, Yugoslavia, Milosevic, and Mandela when he came out of jail in South Africa in 1970 as a war. So I've really traveled the world and worked on the human rights agenda.
Well, good. One other question I'd like to put past you. So previously we did a program, there was an article by a former associate dean of the College of Medicine at University of Pennsylvania. And he was saying that those who practice so-called woke medicine are setting the healthcare issues of Black people back for years. And that all we should do is treat Blacks with standard medicine and not bother with the social determinants of health, basically saying that why should Blacks and Latinos be woke? Why should they be aware of what's going on? And that rankled me so much that somebody would say, you don't need to understand your situation. Just do what I tell you. I'd like your comments on the use of the word woke and how we should be aware of what's going on around us and who's for us and who's against us.
LeBron James should stop talking, just dribble. Trying to confine him and malign him, the basketball player, not accept his ideas. It's a free-thinking adult. He's supposed to Hillary Clinton. He's taking positions, progressive positions. Police and in fact should not just target Black youth. Free grinder. And so he's taking progressive positions. She says, oh, you're a beautiful guy playing basketball. Shut up, just dribble. So we can't shut up and just dribble. We can shut up and talk back, stand up and fight back. But people says, oh, we're hoping we'll make it.
So to end on a positive note, again, one of the phrases that you coined years ago, there were several, but there was one, I am somebody, and the other one was keep hope alive.
Well, what happened was Dr. King, Shield April 4th, Robert Kennedy Shield, June the 5th, at the pulpit of Champaign and watching it. Our leaders have been shut down. And there was a sense of despair about that. And 2 men would die from hepatitis in the camp. And so the people began to leave the camp. And there was no place to turn, saying, I've been asked to be mayor of Resurrection City. I put we set up on the lawn of the between the Washington Monument and the Lincoln Monument. So I was talking to them one morning. Every morning I come out of the truck and give our agenda for the day. That morning it was drizzling a little rain. Women were looking at me, looking up to me to do something for them with them. Had nothing to give them, no bus ticket home, no nothing. I read a book by Dr. Howard Thurman, Jesus and Disinherited. He said, when our backs against the wall and we have nothing, we're disinherited. We feel that there's no way out. You're still somebody, you're still God's child. He said, when you have lost all hope, know that you are living life itself is a great gift. So I said to people, I am somebody. Responded. I may be real wealth, I may be real poor, black, white, brown. So as it came to me that day, it stuck. And I've been around the world, South Africa, Japan, all that. I know people have struggled with that sense of somebodyness, sense of self-worth. And it came out of that situation. We won in 88, won Michigan. We could have won New York, the same hanky panky at the polls. Left everyone down to Philadelphia. 2,000 people there, and some Samuel was running and said we should quit that. We didn't win New York, we can't win. We ain't got in Illinois, we ain't got in California. I said, oh, we can't stop this. I mean, this is a crusade. We got the register people to vote. Out them everywhere. So that night, some of you land back in New York doing press conferences. So I said, we're gonna keep hope alive. You can't make you have hope. Hope can be well weaponized. People try to break your spirit, try to break your hope. You hope and you can have it. God will give you what you can see. Excuse me, sir. That's what you can see. And so you got to see it, believe it, and then do it. You can't make those moves without hope. Without hope, there's nothing left. So hope without work, faith, and hope without the works is dead. So you have to start working to it. Hope for what? Hope for healthcare system based upon need, not upon money. Hope for a system that is competitive in its prices. Canada and Mexico. That happened this week. We have better prices on drugs now. I take a bunch of drugs every day. But not a bunch. I take medicine pockets every day. There's other pills. The cost is big time. It is enormous. So we should fight for the right to have a healthcare system that takes care of the least of these. So I want to urge people, A, to take care of your body. Don't do alcohol and be speaking a lot to the side of your head. Don't do it on drugs. That's what the doctor recommended. It amazing how many people in jail because of cannabis. Now it's legal. I think people should be free to retroactive jail basis. So I also, as school begins, all parents and doctors do 5 things. 1, take your child to school. Most workers let you off for half they do. Take your child to school. 2, meet your child's teachers. they teach everything. You know them, they know you. 3 turn telephone off, TV off, media 3 hours a night. Well, that's what football players do. Basketball players, they turn off 3 hours a day or 3 hours a night, and sometimes more than that. Exchange home numbers. So I get in trouble to call you and not the police. And lastly, figure your child report card. Many kids, you leave home at 7 o'clock, they leave home at 7:30, but they don't quite get to school. If you're in touch with the teacher and she's with you, why is he absent today? Why is not doing his homework? That's a meaningful parent-teacher dialogue. So I want people everywhere. Take your child to school, meet your child, see you change home numbers, turn TV off 3 hours a night. Pick your child's report card. That will reduce absence, and increase grades. My friend, grades do matter.
Well, Reverend, I sure appreciate you. Brenda, do you get to unmute yet?
Yes, I think you can hear me.
No, I only have you on the phone. I wish I had Brenda. She doesn't have her piano, but I sure was going to have her sing to you, Reverend. But I'd like to wish you the best, and we pray for your health and longevity, and we want to keep you around with us a long, long time. Are there any final pieces of advice you'd like to give us?
Well, what you can do is support Raymond. We help trying to get doctors and ministers raise $4,000 or $5,000 for us. We keep our doors open and fight the right fight. Last week in Brunswick, Georgia, we watched 3 white men who killed Aubrey. Yeah, lifetime in 10 years. All white jury. We're changing the nation. We all don't know that if we stand and fight back, always win. We win. So don't give up. Don't surrender. Again, keep your hope alive. I'm fighting Parkinson's. It's
Thank you.
Fight.
Thank you. Ms. Eager, I'd like you to say a final salute to Reverend Jackson. I know I've got you on the phone here. I don't know if we can hear you, but I know you wanted to say something special to him.
That I just love him and appreciate him, praying for him all the time. And God bless you. And again, thank you for living in this lifetime with us, because it's just so educational. You taught us all. I wrote a song called I Am Somebody, and in it, that's it. Country preacher showed us how to give a damn. So we continue to do that and continue to do the work. Thank you, sir. Love you so much, and all of the family.
Well, thank you so much.
By Parkinson's. Take my walking, take my talking. Not my desire to make a difference. Thank you very much.
All right. Have a great day, sir. Thank you so much.
Love you so much.
All right. Have a good day. So that was our chance to have an interview with a legend, a man who's been so important in many of our lives. And he said some very important things about fighting back, not giving up, keeping hope alive. And our theme for the past several months has been resilience. And we've had to go through a lot. And did we ever find Dr. Neighbor yet? Did those alligators get her?
I'm sure Dr. Neighbor is driving too fast for the cell phone towers to keep up.
Well, good.
Is Brenda on?
She is not. I don't see her on right now.
Yeah, Brenda was in Alabama this morning when we did this early, so I'm sure I woke her up quite early. So
One of the other singers who Reverend Jackson helped was Jackie Burdell. And if you don't know who Jackie Burdell is, she was one of the 2 lead singers with the Davis sisters. And when you hear Aretha Franklin sing, the person who influenced her the most was one Clara Ward and 2 Jackie Burdell. And no one can climb a vocal scale like Jackie Burdell. So I was really happy when Reverend Jackson had her saying at some of his push meetings.
You know, something we don't know about you yet, Dr. Jordan, that you used to be a major choir master. And
I was a medical director for the Gospel Convention, Thomas A. Dorsey and Sally Martin. Yeah, that was something I'm very big on. And something you mentioned about woke, I think, you know, around again, we went through that. A lot of the white doctors at St. Francis, Daniel Freeman, Dominguez Valley, they welcomed us to come in and take care of the Medi-Cal patients. But they didn't even think we were supposed to take care of the Black patients who had insurance. You know, I think there's conceptions on both sides of the track with that. And a lot of what we did as integrate the hospitals, we broke misconceptions that white providers had. Many white providers simply looked at us as being the Black doctors who are finally getting a chance to go to medical school to come in and take care of their poor constituents. But they didn't want us taking care of their rich ones with insurance. That was a whole different thing.
Okay. Let me ask.
Mr. Gabriel shaking his head.
Yeah, I just want, hey, my head of Jackson might disagree with you there, Dr. Jordan, but but let me, hey, Randall, what you're doing today, you take me back to my sermon in my church today. We went to the book of Joshua, chapter 1. And, you know, that Moses is dead. Yeah, we thought Jesse Jackson was dead. He's not, okay? But you really, you as you're taking the role of Joshua now, getting us ready to get into that promised land. But you're making, I can't tell you how significant this program is, but I think you know the book of Joshua, because that's what you do. But could you tell us, and you never told me you got an award for the work you did in the Hump Project, man, when you were a medical student in pediatrics Walter Reed.
So I was a medical student assigned to Walter Reed, and my resident was Dr. Walter Fajay. And I had a problem. I needed to do rounds at Walter Reed, and I needed to be in Mississippi. And Dr. Fajay turned a blind eye, and I was able to go to Mississippi with a gentleman who was a past president of the MA, and we founded the Howard University Mississippi Project. But Dr. Walks and Dr. Hines, I'm wondering if we can open our mics to some of our advisory members just to make comments before we leave. Is that okay?
I think we can do that, Dr. Maxey. But before we do that, I just wanted to comment on your interview with Reverend Jesse Jackson and how critical it is for us to be able to build those bridges of communication between some of the folks who have been so pivotal in the advancements that we've made, both culturally and medically. And when I think about the significance of having Reverend Jackson, with his background, his accomplishments, his connections, his strides forward, with someone like Dr. Hines, who is making significant strides with her leadership of the Family Practice Association here in Maryland. When you have the Black Health Trust building that bridge between Reverend Jackson with his tremendous legacy and Dr. Hines in the middle of building her own legacy, I think it's huge that we do that we acknowledge there has to be a connection. You know, when you talk about church services, in our church service this morning, I was in church and we were talking about the pastor this morning is like me, is a big track and field fan, and he's talking about how much he loved the 4x4 relay and the importance of not just passing the baton, but the importance of the person running with the baton understanding how important it is that the baton get effectively passed to the person that is waiting for them, and the person that's waiting for them understanding the importance of being ready to get the baton. You got to stick that hand out. Walt, you know that. Yeah, you got that hand has got to be out there ready. and you got to be running already. You cannot wait until they get there. You have got to be running already and have your hand out ready to get the baton. And so I see a program like this, Dr. Maxey, where we can have Reverend Jesse Jackson and Dr. Jocelyn Hines on the same program as a clear indication that the Black Health Trust values that particular part of what we say when we say in church, you know, guide my feet while I run this race. The part we don't put in that song is just a relay race. It's a relay race, y'all. We got to be ready to get that baton and take it on down to the next person. So Dr. Mason, you know that I have a problem talking too much. Let me just stop there. You go ahead.
Okay, let me ask some of our advisory committee to comment on the issues we discussed today. I see Dr. Rhonda Johnson, Dr. Steiner, Dr. Sherrod, Dr. Willie Goffney, and others. And I also saw a valued past president of the NMA, Dr. Gary Dennis, who's a neurosurgeon. Gentlemen, and I also see a person who can make a comment about this Paxlovid, even though she works for a rival company, Miss Bryant. So I'm going to ask Simon to open up some of our advisory members for comment.
I see Dr. Sherrod's hand was up.
Okay. Dr. Sherrod?
Oh, yeah. Yeah, Dr. Maxey, thank you so much for getting that interview with the Reverend Jesse Jackson. And I'm just going to just summarize what Dr. Waltz has already talked about, the importance of getting the wisdom, getting the baton, having your hands out and actually running already. And that's what the bird Sankofa in the African culture symbolizes. You got to know where you came from to know where you're going. The bird is stepping forward, but looking back, getting the wisdom, and then moving forward with the egg in the hand for evolution. So it's very important that we get the wisdom and move forward. The other thing I wanted to say too is that, you know, this racism stuff in healthcare is a major. I just had another experience with another relative of mine who actually tested positive for COVID, was fully vaccinated, but was having some symptoms, pretty symptomatic, a younger person. And the mother called the doctor and said, you know, we need to come in. This is on a Friday. And this is in the state of Illinois. And the doctor said, well, what center did he get tested at? Well, we don't take patients. We can't see him today if he tested at that center. You'll have to go see your primary care doctor on Monday. So this child is sick and coughing. And so, you know, of course, I intervene. And I think that one of the reasons for the Black Health Trust is that we point out these cultural differences, and we have to advocate for our patients and ourselves. So I actually had to go to my treatment regimen, which has been working and has worked in several of my relatives. And, you know, I put him on Valtrex and clarithromycin. Within 24 hours, his mother calls me back and said, wow, that made a huge difference. And so even though we don't have a randomized controlled study with that, we do have 47 patients that we know it works in. So that's something to keep in your back pocket when you can't get in to see your doctor or your doctor refuses to see you. You need to know that there are other things out there that will work and save your life, perhaps, if you can't get in until Monday to see a doctor, or you end up in an emergency room, and you know how disastrous that can be. But it's important that I think that we promote on the Black Health Trust the other things that we can do in our culture to save our lives, like making sure everybody has the vitamin D level over 50. And the other thing that I think Dr. Jordan mentioned is this obesity problem. It's something that we need to actually be aware of and deal with our population, because it seems that the mainstream is trying to make obesity okay, and it's really not okay. You know, we know that people with obesity are at higher risk for dying from COVID, and it's just not good for your overall health and well-being. So these are the kind of things that we are really pushing
So-
on the Black Health Trust.
So
Yes,
Dr.
if you
Sherrod,
have 37
I
people,
want,
you should publish that.
Pardon me?
If you have 37 people that you've used Valtrex on, you should publish it.
No,
If
I
you
don't
just
have
say publish
37.
as an
This is another,
observational.
yeah, this is another practitioner who treated 47 patients with Valtrex and clarithromycin. But I myself have treated 2 patients and they responded right away within.
So let me, so Dr. Sherrod, I'm sorry to interrupt, but let me just be clear that there are several different kinds of very important information that you're giving and that Dr. Jordan is giving. And information about the risk of obesity in our population is absolutely something that has been well studied and we talk about on the Black Health Trust. And we can't talk too much about that. It is huge. We have a lot of folks on the entertainment side who are celebrating this, body image and all of that. On the other side, when we talk about getting things like clindamycin that would need to be prescribed, and those are things that come under our advisory committee meetings, because when we talk about other treatments that are not FDA approved or haven't gone through our committee, we want to talk about those kinds of things in that meeting because they're very important. And at the same time, we have different venues for looking at things like obesity and blood pressure and all of those versus looking at prescribed treatments that we want to just, it's a different venue for us to talk about those things. Is that fair, Dr.
Yeah, I understand. It's not clindamycin, either it's clarithromycin, but let me just say this. I think we do need to discuss those things and talk about things that we can tell our culture people to do to try to save their lives because they do not have the access to the system like Dr. Fajay had, or even just trying to get to my niece was just trying to get him to a doctor and couldn't even get him there. So I think advocacy is a major thing in our population. If you have an advocate, you need to have somebody there with you when you're ill to talk for you because you're not thinking straight when you're sick, you don't feel well. But I understand exactly what you're saying. I just wish that we could come up maybe with a protocol for that's not in the general narrative, things that we need to do that may not be in the general population to do. And that's what this is all about. The cultural things that we need to do that are not in the regular narrative.
One of the other points that I think that got brought up from Dr. Sherrod's comments was also about, healthcare and race and ethnicity. And one of the things that we has to keep on our radar is now, for example, some of the entities that govern like Medicare and your insurance company practices, the NCQA and things like that, they're all interested in collecting race and ethnicity data. And on the good side, it has come from the emphasis on looking for biases in healthcare, where you can't look for biases in healthcare that are based on race and ethnicity without necessarily knowing what the race and ethnicity of people are. On the flip side, though, to Dr. Maxey's point earlier about how we ended up with, alternate standards for, kidney function numbers or potentially pulse ox numbers, what we also have to keep an eye on is, are we using this information to standardize and make sure that people of various, not just Blacks, right, but we're all getting optimal health care? Or are we using this information to change the goal line, right, so that then we can make the numbers, different for different groups? So I think that's something that the Black Health Trust will certainly have to keep on our radar. To your point about obesity and normalizing obesity, there's a difference between a healthy and positive body image and recognizing the negative impacts of being obese. You can actually do both, right? You can still feel good about yourself and be proud of who you are, while also recognizing that in my current state of being, I'm at risk for certain things. And I think that's some of the things that we can talk about here on the Black Health Trust, that those things don't have to be exclusive, right?
Dr. Hines, I sure thank you. Let's recognize a few more members of our advisory. I see Dr. Goffney, Dr. Steiner, or India.
Dr. Maxey, Dr. Goffney put in the a statement in the chat about some patients that he had treated that if I can say that, because Dr. Goffney also put in the chat that he is on a computer that doesn't have a microphone or a camera. So we're going to have to speak up for Dr. Goffney. And Dr. Goffney wrote that let me just read it. I've had 4 patients over the last 2 months who have called me as a surgeon after testing positive for COVID. Each of these patients had reported the positive test to their PCP, and none of those physicians had even mentioned Paxlovid to the patients. I put each of the patients on Paxlovid and they all improved. I suspect if these patients had been Caucasian, they would have been offered Paxlovid by the PCP. And I think that goes in line with what we're talking about, where there is unequal care. That's not my opinion. It's been well documented many times that folks get unequal care based on how they appear to the physician.
Wasn't that the title of the Institute of Medicine in 2003 report they put out?
I know the report was there, and I'll just make a comment. I've been written about a lot of places, and one of the places I'm most proud of is there's a book called Medical Apartheid, and I got a little tiny reference in there because there was a time when I refused to agree with the CDC that we should vaccinate everybody in Washington, D.C. for anthrax, and it was a positive comment in there because we have to be aware that our people can be treated differently if we're not paying attention. And as the public health officer, what they were asking didn't make any sense to me. And I stood up and I said, no, I'm not going to recommend this. I don't think we should do this. And I think to go back to Reverend Jackson's interview for just a moment, Dr. Maxey, what Reverend Jackson did, I think is amazing because he's Reverend Jackson. He wasn't Jesse Jackson, MD. And that legacy of Reverend Jackson touches so many parts of our history, so many parts of our community in so many ways. And I just like to say that anybody who feels that they're limited by their degree or limited by their training, nothing stops you from dipping into other areas with the right communication and the right support and making an impact. And I think Reverend Jackson's life is an example for us that we can be active and impactful in all other areas of our larger community. And it doesn't matter what our degree is or what our initial training is.
Yeah. Is Dr. Rhonda Moore Johnson available?
I don't see Dr. Rhonda Moore Johnson.
Okay.
I do see Dr. Steiner.
Okay.
Okay. Yep. Good afternoon, everybody.
New Hampshire or Vermont? I forget.
Still in New Hampshire up here. Yep.
Okay.
And kind of warm. Good to see you all every Sunday. I just wanted to echo some of the themes we talked about today and in the past. And I want to thank Dr. Jordan specifically for a great presentation today that kind of broke through and brought forward things like AIDS and all. And Dr. Hines as well, who mentioned having an advocate. We talked here about having a plan if you get sick with COVID. And I think one of the things that we didn't specifically mention was to have an advocate too, for a lot of reasons, to get access to care, to get access to equal care if you can, and also to help you through the maze of resistance that's put up almost for everyone that tries to get healthcare and off hours or whatever. So I think we can't stress that enough, and we haven't. So thanks, Dr. Hines, for bringing that up. And I think the other theme about obesity, our good friend Bill Maher discussed that a week ago. If you want to catch it on YouTube, that it's something that we can't consider woke. We have to face the bull in the face kind of thing. This is a real problem. It's at the genesis of hypertension, cancer, stroke, everything that kills us, kidney disease, etc. So let's talk about it more. And of course, we have on the Black Health Trust, we've talked about diet and had some tremendous programs on it. So I think this all kind of reflects back to encouraging people to take responsibility more for themselves, and maybe if they have to, for others who don't take responsibility for themselves that are near them, to become an advocate, to form those relationships and help each other. So thank you all again for being here today. And me and my wife, we watch this every week and love it. And so do our friends. Thank you.
Well, thank you very much. Is Dr. Dennis still on?
Dr. Dennis is on, yes.
Dr. Gary Dennis, my leader. Would you care to make a brief comment?
If we can get Dr. Dennis unmuted.
And I noticed Miss Gerald Bryant, who is a rep for a very important firm. Is she unmuted, Ms. Bryant?
If we can get Gerald Bryant unmuted, please.
Good afternoon, Dr. Maxey. How are you?
I'm very good. Welcome to the Black Health Trust. This is your field.
Actually, I am not representing a competitor to Paxlovid at this time, but I do thank you for allowing me to comment. However, I have heard anecdotally that it's very hard to get, and I've had friends and colleagues that have been positive, and it's just not readily discussed by our primary care physicians. And even I've heard that you're supposed to be able to get it at the pharmacist without a prescription, and that does not seem to be actually the truth. So I'm very concerned about the accessibility of Paxlovid.
Thank you very much. And also like to get a brief comment from Dr. Gibson, if he can be unmuted.
I am. And I must speak to that when I hear a comment about that availability of Paxlovid. It's like healthcare in general for Black people. The access is inequitable, and it is not even across the board. That's why it's so important. What the mission of Black Health Trust is so important, so that you can have trusted advisors and networks. The network effect is tremendous when you need access to information. You need it fast. And, when one don't, the other will. In the case of knowing what it is that you need to do when it comes to your medication, talk to your pharmacist. You'll be amazed. You find access to a lot more physicians and access to a lot more medications and therapies that you must have to stay well in these trying times. Thank you.
Thank you so much, Dr. Gibson. Is Dr. Dennis unmuted?
Yes, I'm unmuted, I think.
Hello,
Can you
Dr.
hear
Dennis. We can hear you.
Yeah, I'll tell you, this is a very good day. The weeks are coming. They're getting better and better. But there's a lot that we have to be exposed to in order to help our patients. So therefore, we just can't stop with one good day. We have to be good every day.
Amen.
And so we have to point it out to our patients. It's amazing how many of them don't know about the simple alternatives to immunizations, as well as those that can receive immunizations when they thought that it was something that they were allergic to. I think that we have to be there. Somebody has to do it. And for some reason, it hasn't been done. And of course, Jesse Jackson has been a leader in every way, and probably every person that sat around that table, even though we may have been in other locations, have been influenced by Jesse Jackson. And Jesse Jackson was looking around for a book, one of these books from the National Academy of Sciences that had actually been published and examined because of our relationship with his son, Jesse Jackson Jr. And we took it to Congress, and they paid for a very extensive study that gave almost all the statistics that you can hope for. And it was because of Jesse Jackson. If without Jesse Jackson, his son would never have been involved in it. But so we really have to be out there and thank people like that. Not only because, you know, we stand on their shoulders and we do what we need to do, largely because of what they've done. And we should find ways to congratulate them. And as they get older, we don't want to turn our back. Let's take care of them and make sure the community does too.
Thank you so much, Dr. Dennis. Well, we're at the end of our time. So I'd like to invite Dr. Hines and Dr. Walks to have some final words before we pray for the alligator alley that Dr. Neighbor Stevens is safe. Dr. Hines.
Well, first I'll just say it was a definite honor. It's always an honor to be on the Black Trust, to have been invited to participate in the Black Health Trust. It is not lost on me the Black excellence in so many ways that is demonstrated on this program. And today was just another demonstration of that. The other thing I will say was this conversation brought up multiple topics that we can talk about at future meetings, including, how the Black community deals with obesity, LGBTQ communities and embracing them. And there's multiple things that came out of today's discussion that we need to have some follow-up talks on, and including some things, advocacy. And sometimes one of the things that I think I'll just say last on this Paxlovid conversation is just around, don't assume that your providers know. Don't assume that your information, and doctors are humans like everybody else, right? So some of them are going to be in the know about how to get things and how to navigate for things. And some of them are not, especially as things are new or newish, just like all the rest of the people in the world. You have some people that are early adopters, some people that are going to wait a while before they prescribe it. So all of those things are true. But one of the things that I think comes out of this program is you can walk in armed and knowledgeable about what your expectations are, what you want to get out of today's visit, right? I came to get some treatment. And if I can't get the treatment that I'm intending on, why not, right? What is the reason? Because there might be a reason. Maybe you're 7 days into your symptoms instead of, 3 days into your symptoms. There could be reasons, right? But I will end with just saying it's an honor to be a part of this program, and I appreciate it.
Thank you. So I'm going to send you a number. I want you to reach out to Simon, Dr. Hines, and get you your background so you can look like Dr. Walks and me. Dr. Walks, my friend.
Dr. Maxey, I've talked a lot already today, and I would just say I would echo a lot of what Dr. Hines has said. The conversations that we start are so important on this program, and it matters. It matters that the health of our communities are important enough to us that we do this, and the folks who tune in regularly. Dr. Steiner's comment that he and his wife are with us every Sunday is an indication of his level of caring and interest, and his wife's level of caring and interest. I think it's just important that we recognize that before we can do anything, we have to learn a little bit about it, or at least be exposed to it. And so if we're not willing to listen to the information and all of the beginnings of conversations that we talk about, that Dr. Hines mentioned, and then have a little bit of curiosity to at least, type something into a search engine and read in your Chrome or Firefox or whatever you use a little bit of information. We are oftentimes surprised when we do that, that something, wait a minute, that's really going on? Wait a minute, you mean that? And to me, that's what woke means. Woke means that I wait a minute, that's really going on? My eyes open, and I say that this is something that I need to learn more about. I need to pay more attention to. So I continue to be excited, Dr. Maxey. I appreciate your leadership in this. I hope we can find Dr. Neighbor Stevens, whatever rest stop she's pulled over in, taking a nap. I hope she's doing okay.
Okay, well, very good. And I neglected to recognize Dr. Wilbur Jordan. Are you still on, Dr. Jordan? Okay, he may not be. But what I will say in closing, I want to recognize that the interview with Dr. Jesse Jackson was a product of William Dickerson, Bill Dickerson, helping me over the past few months make it happen. I'd like to thank him publicly. Thank you, Mr. Dickerson. And I also like to bring to your attention, and Mr. Herb Darcy, if you would put again in the chat this wonderful device that Dr. Waltz and I bought that helps lower our exposure in the atmosphere of our homes to COVID and any other infectious device in the air. And we hope everybody has a great day. And I'd like to give thanks also to the Reverend Jesse Jackson for giving us time on the Black Health Trust. Have a great day, everybody. Have a good day. And thank
Bye,
you,
everyone.
Thank you, Simon Cooper, for being with us.
Thank you, Simon.